but I've got.
Okay, we're live. Oh, it's setting up your meeting on Facebook Live. Sorry.
I mean, it sounds creamy.
Does it say it? Okay, we should be live. Hi, guys.
Hi, everyone. Thanks for joining us. I'm Dr. Sheena Buba.
I'm Dr. Benisha Williams.
And together we are
Shanisha.
Okay. And thanks for joining to our second Facebook Live. We've got a special guest here today. Let Benisha introduce our guest.
So our guest today is Dr. Omar Selod. He is my partner in crime at work. I met Omar in 2009 when I was a first-year medical student, and he came and taught us all about PM&R, and I was like, I want to be just like this guy when I grow up. Had an opportunity to rotate with him in medical school as well as residency, and then he offered me a job when I finished my fellowship. So, Omar, welcome to our show.
Thank you for having me.
Good. So why don't you tell everyone about yourself, Omar?
All right. So I am in private practice. We have four partners. I have four partners. There's five of us total. Dr. Williams, Dr. Lanley, Dr. Neha Shah, and Dr. Austin Watkins. We have a private practice physiatry group here in Fort Worth. My story is that I went to medical school in Kansas City. I kind of, in my third year, I kind of didn't know what I wanted to do. I was doing a bunch of rotations, and I just would get frustrated with, I'd like a rotation for a month, but I couldn't imagine myself doing that long term as a job, and I was really starting to get frustrated. So there was a guy rotating with me on radiology, I remember, and he had mentioned to me physical medicine rehabilitation, and I had actually never heard of the field, despite being the son of an orthopedic surgeon. So I remember going to my dad, who's an orthopedic surgeon, and asking him about the field, and he was like, yeah, I think you'd like that. So I did a rotation as a third year, and I liked it a lot, but I wasn't 100% sold. I did a show rotation at Baylor, Dallas, and that was the rest was history. I knew I wanted to do PM&R. So I graduated from Kansas City a long time ago, back in 1997. These two people on the screen with me probably were in middle school at the time, if that. And then I did my internship at TCOM here in Fort Worth, where I grew up. And then I did my residency at Baylor University Medical Center in Dallas. And I've been practicing for 19 years, going on 20 in August. So that's my story.
Nice.
Excellent. So I'm echoing, I realize it. So I'm going to be going on and off with the mute, so it's not as bad on our side. So first question for you, Omar, is how many medical students have you mentored into PM&R?
So I probably should have counted before I came on here. We have a wall in our office where I kind of pin all the students I have and where they do their residency. And I do believe that we are at about 100 students, maybe actually a little bit more. This last year class, yeah, there it is. There's the wall. This last year's class is not on there, that just graduated and just matched. And there was quite a few of them. They're fantastic. So I would say about 100 students that I've had have gone into the PM&R.
Which is a lot, considering we're such a small field.
And a lot of them, their first exposure to PM&R is with you. And I know you also have residents, so I rotated with you as well at Baylor, Dallas.
That's what's funny about today is I'm actually used to grilling the both of you, and now y'all are asking me questions.
Yeah, you're in the hot seat.
And when I say, you guys, when I say grill, like you better know your stuff if you're going to be rotating with Dr. Selod.
Both of y'all always knew your stuff. Both of you always knew your stuff.
Because we are scared to look dumb, so we study.
You don't want to disappoint Dr. Selod, yeah. Yeah, he'll make you draw out the brachial plexus, you have to have every single nerve root on there. And because of what he made us do, I can still do that to this day. So, yeah. So in terms of medical students, are there, what kind of advice can you give for like each year? So first year med students, second.
Right. So, so most of my students come from TCOM just because I'm in Fort Worth. There's actually a funny misconception amongst TCOM students that I actually myself went to TCOM, and I did not. I actually did not get into TCOM. But it's kind of funny now. I mentor quite a few of their students. So
and all of your partners went to TCOM.
All of my partners went to TCOM. So I tell people when things don't go your way, just be patient, work hard. It all comes around. So we start talking. Dr. Williams and her classmate Aguche Azuike. They kind of started a PM&R club. I had some students prior to Dr. Williams' class, but there was nothing really formal at TCOM. So they kind of launched a PM&R club. And ever since that launched, we actually started mentoring students at TCOM their first year of medical school. But that being said, I get people that sign up for me that think they want to do PM&R, and they really don't decide till midway or the end of their third year, which is fine. Obviously, the sooner you know, the better. I really don't think you can know what you want to go into until you actually spend time in the field. Sometimes people will come to me and say, "Oh, Dr. Selod, I want to be a rehab doc," and I'm like, "Well, how do you know? You haven't spent one day in clinic." So first, get to know it and make sure you want to do it, because there's a lot of misconceptions about PM&R that the old pleasure, money, and relaxation is the actual fib. It's a lot of work. It's a lot of hard work. As any profession in medicine is going to be. If I could give the sooner you know, the better, but you've got to obviously go find that. You need to do a show or a rotation prior to your shows, right? Like medical school has gotten so competitive now. If I was applying, I'm not, when I was a med student, I was not nearly as good as the current class that just went through me and matched. I mean, those guys were fantastic.
So smart,
but they're on their game, and many are on their game early on. You need to go do things show interest, right? Like here in Fort Worth, Charlie Kenyon, who if you're on Twitter, which I think a lot of people are on Twitter nowadays, he is a must follow. But he kind of got Rise Adaptive Sports kind of going with the school, where a lot of students in their first year and second year will go out and work with, do quad rugby events, go water skiing with a paraplegic, stuff like that.
Yeah.
And
he got us residents to cover some of those events.
Yeah.
And residents, which were amazing.
Yeah, now residents actually do that. So it's important to try to do that in your first and second year if you can, just to kind of get exposed to the field and the patients you're going to be dealing with, because I tell everybody, I can give up and give a lecture your first and second year, but you don't understand PM&R until you actually go see it. It is just one of those things. You've got to go see it. We don't have a body part like, when you say cardiology, you think about the heart. When you say pulmonology, you think about the lung. When you say physical medicine rehab, what do you think about? And we're about function, as you guys know. So, in your first and second year, you need to do that. If you can do a research opportunity, I would definitely jump on and do that. But if you don't even have all that stuff, as a third year, if your school allows you to do an elective rotation early on, you need to do that, even if it's for 2 weeks, just to see what the field is. And, if you like it, you need to find that mentor that's going to kind of support you and challenge you. You don't want to just do a rotation and just kind of be a shadow with the attending. You need to learn, so that, most of my students, Dr. Williams can attest, when they come to me, we have pretty high standards in our clinic. You're going to get pimped pretty hard. You're going to have to do reading assignments and be well prepared, so that when you do go up to your actual show rotation, you do look competent.
You have to do a lecture.
Yeah, a lot of people ask about board scores and GPA and all that. And obviously, the better the score, the more the doors are going to open. But I've had a slew of students that have had high board scores, and many that have maybe not had as competitive board scores. Really, you've got to show well on your show rotation. Board scores can open up some more interviews and some more opportunities, but you
have to show well.
Prepared, you can overcome all that stuff. And our field is very much about compassion and connection with the patients on the spinal cord unit, on the brain injury unit. So if you can show your strengths in those fields, you can do well. So I think it's dangerous to say, oh, I want to do PM&R without seeing it. So I tell all the students, I've had some students come up to me over Christmas break. They're like, hey, I couldn't get a rotation because, unfortunately our rotation will fill up pretty quickly here. And I'm like, well, then you need to take 2 weeks off during Christmas or whatever time you have and see it, because this is your job for the rest of your life. So you've got to go, PM&R, you've got to go get it. It's gotten
you have people fly in to rotate with you.
Yeah. We get people coming from out of state, but it's gotten so competitive. The number of medical school seats has increased. Not the number of residency seats has not proportionally increased. So there's just more demand right now. And rehab it used to be a secret, so to speak, when I was a student back in the day, but no longer. Everybody's heard about it and everybody wants to see it. So, you just got to prepare that way.
That's the thing, that to really reiterate, obviously the better your board scores are, the more doors will open, but really PM&R is a field that if you show interest, earlier on is better. I think I had posted on our Instagram page, what do program directors look at the most in terms of, having someone come in and interview with their program. And one of the top 3 things is, showing compassion, showing that you've been involved in the field and kind of seeking out those experiences. So.
TCOM's got a pretty established PM&R club, but other schools often don't. And so some people will reach out to me. And so, okay, your school doesn't have an interest club, go start it, go do it, go get it. Nowadays with social media, there was no social media, years ago like there is now, but there's a lot of opportunity on social media to connect with various residencies. They have pages on Instagram, they have Facebook pages where you can kind of connect with them. Program directors are all over social media now. So, even if your school is smaller and doesn't have the presence that, TCOM, I believe Rutgers, I've heard, also has a relatively big presence. Go create your opportunity and go get it. It can be done.
So we kind of were just talking about this before we started the live, because with COVID, a lot of students are losing those away rotations. We're telling them to seek out these opportunities, and some of them aren't there, which is very unfortunate. So that's what actually made us start this page and trying to have people on to help get more exposure to the field during this time. What do you think students can do to try to seek out those opportunities given the COVID situation? I know you said social media, which I think is an excellent idea.
Yeah, so this is a tough one because nobody knows right now, what's going to happen. I think it looks, pretty clear that show rotations are going to be difficult to be had during that normal time period. So for all those third-year medical students out there right now, it's going to be tough for you guys, and believe me, I feel for you guys. It seems unfair. There are things you can do. Another person to follow on Twitter and on social media is Nicolette Finger. She's fantastic.
She'll be on next week.
Yes, she'll be next week. She is. I can't rave enough about her and how energetic she is, and she's one of those people. When I say go get it, Nicolette goes and gets it. You don't have to tell her to go get it. But that being said, we were actually talking today, and she had, she knew I was going to come on, and I had asked her for some, like, hey, what do you think? And she had mentioned that maybe see if for didactics for various programs, can you ask to Zoom in. Some programs I think are actually now starting to invite students that would normally do a show rotation. Why don't you come in and do Zoom in during our didactics, weekly didactics. Most programs have weekly didactics. So if there's an opportunity to do that and show interest, I would definitely do that. With COVID, go ahead.
To add on to that, I would say what you can do is if you do Zoom in, ask them what the topic is ahead of time. That way you can read about it and then really know, and then ask them point questions and stand out that way.
Right. And
you can even ask them to, can you give a presentation? You can kind of give a topic. Yeah.
Right. Yeah. Be proactive and, reach out to the residents too nowadays, because I mean, one of the advantages of going on interviews, which now they appear that they're going to be virtual, is when you go to an interview, you get to get the feel of a program and see a program. And there's no way for video to replicate that experience, but you're going to have to reach out to a bunch of residents. The thing with PM&R is most of the residents are very kind. Most of them are very helpful. It's just when you go to our conference, you just find the nicest people that are always willing to help each other out. So reach out to them. And that's another thing is usually I say, people ask me about, should I go to the annual conference or not? And usually what I tell them is you don't have to go. Things get expensive. But if you can go, it's not going to hurt. I think in this environment, it would be ideal to go. That being said, who knows if there's even going to be an annual conference right now, as I believe it's scheduled to be in California right now. So, I mean, who knows if that'll happen. But if it does happen, that may be a good opportunity to get to, although I don't know if it'll happen.
So let's say you're a fourth-year medical student and you are able to go on away. What are some topics that you think are crucial to know going into that rotation versus going in blind and not really knowing anything?
Yeah, so, I, for whatever reason, from my experience and from obviously dealing with a zillion students over the years, like we've had everybody kind of know their neuroanatomy in pretty much detail. You have to be ready for that question that comes your way. Those are questions that you would have learned in your first and second year of medical school. We all take anatomy. There's some nuances to rehab that there's just no way you're going to know, how to define a spinal cord level and stuff like that. I mean, I think that's difficult to do, although our students, we do try to, when there's an opportunity to teach them some stuff, but you've got to read ahead of time. There's stroke, there's spinal cord, there's brain injury, spasticity, meds, MSK. I mean, the field is so incredible because it is so broad. It's, I don't know what topic you need to know. I would say if you're going to do certain rotations during the month, then definitely read up on that. But you've got to know your stuff walking in. You've got to show why me.
Right.
Everybody can show up. Why you?
Right. Sheena, do you think there's any particular things that you would recommend that students know going on a rotation?
Yeah, I think so. Like Tinder asked if there were any specific books or resources we recommend for auditions. So I know when I was a medical student, there's a Pocketpedia guide. So it's a really pocket-sized book you can keep in your white coat, and they've got major topics on spinal cord injury, brain injury, spasticity management. So that's always nice to kind of be able to look through when you are auditioning on those rotations. And then I also liked the PM&R Secrets book. So that's a book, it's divided into different sections, different categories, and it's just asking questions, what is spasticity? And then it gives you, a nice explanation. So it's nice to kind of read through that if you're specifically going to be on spinal cord injury rotation or brain injury rotation.
Right.
Those are the two that
Cucurullo is a good book as well. I think it's a must have and a must read.
Definitely for residency. Would you recommend a med student?
Yeah.
By that, yeah.
I tell all my students, I mean, we're going in.
I think it's a good resource because if you don't know something, like you can go and look at it. Like no one's going to expect you to know it like you're a fourth year PM&R resident, but it's a good place to like, oh, go look at this chapter in this section and you can get some more information. The Encyclopedia is great, but I don't think they make it anymore.
Yeah, I have most of my students, if I tell them, hey, tomorrow, let's go talk about CRPS or whatever. I tell them I want them to read at least out of Cucurullo. I think it's great at putting it down for them. Residents use it as well for board study. Sometimes, obviously residents will also go into Braddam and the like, and, with more depth and detail. But I think Cucurullo is fantastic for that. They usually can handle it.
So what would you tell, students who are like, yeah, we're going to PM&R. I really want to do pain. I love doing injections.
Yeah.
What do you tell
them? So here we go. Well, I mean, I personally think go into PM&R with an open mind, right? Sometimes students come to me, oh, I want to do PM&R, and I'm like, you don't know that yet. Come hang out with me. Let's see if you like it. If you don't like it, by all means, go do something else. You got to go do something that makes you happy. I don't care what you do.
He literally told me that on day one.
Yeah, I don't care what you do. You got to go be good at it, and you're going to be good at it if you like it. You got to show up every day to work. You have to have your A game every day. Same thing for, if you want to, when you go into residency, I think it's very important to go in with an open mind. I personally thought I was going to do a sports medicine fellowship. So because I wanted to do a sports medicine fellowship, I used to hang out a lot at the Friday night football games. In our residency, we were supposed to go to 2 Friday night football games. Well, if I wanted to do sports, I need to do more than the minimum. So I would go, more than what was required from me. And then, after that, I was like, well, I felt like I got enough experience with it. And I don't think I want to do this fellowship, which is fine. So just go in with an open mind. PM&R, there is nothing that can prepare you for residency. It is so vast. It is so interesting. It is so diverse.
And it's 4 years.
Yeah.
Some people might not want to do that 5th year.
Yeah. No student understands it until they get into the residency of it and they learn the details and the nuances of it. So go in with an open mind. I mean, I know people want to do pain, and that's fine. I think pain is great. I think physiatric pain docs are great because of our approach to the patient as a whole. But go into PM&R with an open mind. You're going to do better too. I mean, every now and then, in years past, sometimes there might be somebody who just is checked out on all the other aspects of rehab. You can't be like that. You're in residency. You
cannot be like that in residency. Yeah, that's a good way to piss your program director off.
Yeah, you need to be all in as a resident. You've got to take your boards. You're going to have an oral exam. Don't shortchange your education. So go in with an open mind.
Okay, Hayden asked a question. He says, Dr. Selod, is there anything you wish you knew as a resident before graduating and working? And we could probably chime in.
I'm a big fan of Hayden, by the way.
Hayden's awesome. He's helping turning this into a podcast. Shout out to Hayden.
So, I mean, I think the thing that you need to do as a resident is also understand that business side of the field. I had an attending, Michael McHenry, taught me a lot of private practice stuff. I probably should have paid more attention earlier on. I think the last 6 months of my residency, I started to get in a little bit of a panic mode and whatnot. But no matter if you're working for an institution, no matter if you're working private practice, you have to understand the business side of medicine. And too often you kind of play that off. First, you got to understand PM&R though. I mean, let's not kid ourselves. You have to spend time understanding the field of physiatry and head in the books and learn it and attack it. as you mature in your residency, you really just got to start paying attention to that kind of stuff. And then, you know, like I said, I do see a lot of times residents that think they want to do something. So when you're in your residency, if you think you want to do a brain injury fellowship, go spend extra time with brain injury. If there's a weekend retreat, if there's something where you can go help patients, spinal cord, whatever, go spend extra time doing that. You know, make sure you know what you're getting into. You know?
Very good. Okay, Dr. Cindy Pham asks, it's pretty scary going out there on your own. How did you prepare for transitioning to attending HUD?
I mean,
Scary.
trust me, Cindy. I made plenty of mistakes. You know, the one thing with doctors in general that I will say is doctors need to be humble, right? Like,
And ask for help.
This doctor complex will hurt you if you truly have it. You're going to make mistakes. You don't know everything. So as you transition, you've got to find that person that's willing to teach you, but you have to be willing to be receptive to advice and to criticism, right? It is very scary. It's very scary being in the room without your attending. My mentor was Barry Smith. And I remember many a times I would do an EMG and I was like, oh my God, I don't know about
what would Barry think?
And I would call him. I would call him. You know, he was that kind of a mentor that would answer your phone call in, you know, always teaching you. And I would call him and I would ask him, hey, did I do the right thing here or not? Should I have done this? Should I have shocked this nerve? Oh no, the patient's gone. I can't call him back. But, you know, do that. And also, you know, about business too, you know, find somebody that you trust. You know, not everybody is trustworthy, but unfortunately, everybody also doesn't understand the business side of medicine, but they think they do. I've been to many a doctor meetings where I sit around a bunch of physicians who think they understand insurances, ACOs, things like that. Go find people that are not physicians and learn from. I've learned a lot from many friends that are on the business side of medicine, the admin side of medicine. They understand things a little bit better than we do on that side. So be humble and be like a sponge.
Ask for help.
Ask questions, ask questions, ask questions. Do not be quiet. And this goes from when you're a medical student rotating, when you're a resident rotating, and when you're an attending. Ask and learn. You don't always know everything. You know,
Omar and I's office is right across from each other, so at least 3 times a week, I'm like, what do you think about? Can you look at this MRI? What do you think about that?
And I learned to this day from my junior partners that, you know, I remember, you know, a couple of years ago, I had somebody rotating with me and was telling me about the FLAME trial, you know, and I was like, what's that? You know, and so, I mean, I learned things from them. You can always learn, but you got to be a sponge, but you got to be humble. You got to be receptive to learning and some criticism.
Yeah, and I think like reach out to also the people you're in residency with. We have a WhatsApp with all of our residents that are now all attendings, and we ask each other questions on there multiple times a week. Everyone does.
Yeah. And social media is a great resource. I mean, on Facebook, there's a women's physiatry group that people are always posting Facebook questions on. There's a general PM&R group as well. So it's nice to have that network.
Yeah. And remember too, when you ask questions, this is back to Cindy's thing, like, you know, go find somebody, you know, if you're private practice that can answer those questions in a private practice setting. Like I'm private practice. If you have questions and you're employed by the university, you know, I don't know how that system runs, how that RVU runs. There's somebody that knows that better than me. Go ask them. You know?
Yep. Let's see.
Morgan was asking for students that don't have that home institution or have time to do a rotation because of scheduling the way that clerkships are made out. How do you gain more exposure? And I think you kind of touched on that earlier. You know, you have to, like, anytime you have off, you got to try to find, like, if it's Christmas break, spring break.
Yeah. I mean, you have to find time on your time off. Renee Rosati is over at Vanderbilt right now. And I remember she couldn't find time in her schedule. And I think she actually reached out to Baylor and Dr. Williams, the resident, and said, call Dr. Selod, and shows up in my clinic. And if I'm not mistaken, it was during her summer little break that she had.
She was at school in Arizona.
She was
Right.
in Carolina, if I'm not mistaken. But I mean, she came during the time. I had another resident or student named Angela who came over Christmas break for 2 weeks, and she's now doing OB-GYN, but she was like, I want to get this PM&R itch and see if it needs to be scratched further or not. And so she came for 2 solid weeks during Christmas break. And, and then she said, you know what, I think I want to do OB. And I was like, perfect. At least you won't have any regrets. So unfortunately for you guys that don't have that opportunity, you're just going to have to take time out. It's worth it though, because I've had a lot of residents that are in medicine or family practice that, come to me and say, hey, I want to do rehab now. And it's very difficult to transition. I've had a couple that have rotated with me, said they want to do family practice, go do family practice, then call me their first year and say, hey, Selod, I want to switch. And, to date, we've been able to help most everybody out, but the field is now getting so competitive, it's getting harder and harder.
And I think if you don't have a home institution, obviously we're all in the DFW area, is to kind of Google what practices are around your area and try to maybe reach out to those physiatrists. Almost every inpatient rehab hospital should have a PM&R doctor there. So that's a good way to kind of also seek them out and try to get an opportunity.
Exactly. I mean, this is how we have to get creative on how you're going to set yourself apart from the other candidates, right? So unfortunately, we're in this situation. A lot of people aren't going to be having those away rotations. You just have to seek it out. Even if you can't fit 2 weeks in your schedule, maybe a Thursday and Friday, just shadowing, spending some time in a clinic. And I think that will, you're going to have to, make yourself.
Yeah, I've had people that have been on, with our rotation, we actually book up usually, but we're a year booked out. And so I couldn't get the rotation. And so they're on an easier rotation where they get off at noon and then they slide over to clinic. But, they go get that's back to go get it. It's just got to go above and beyond if you're in that predicament.
And I know a lot of people try to rotate with Omar, and he can only take so many students, and he does a good job. And us junior attendings, I'm trying to learn how to be better at that, because I feel like what do I have to teach? Nobody wants to learn from me. but I'm trying to do better and take on more students as well. I'm just not as busy as Omar is. And I think we're good at kind of pulling stuff out. Like if I have a Botox that I think is interesting or a migraine. Yeah. Unfortunately, like for my injections, if it's an ultrasound injection, I always try to pull students in. But for our fluoroscopic injections, some of the surgery centers are really tight about letting people come in, which is unfortunate.
All right, what else we got here?
Let's see. How can you find a PM&R mentor in the U.S. as an IMG? I think it's the same thing. You're just gonna have to look into your area.
Yep.
And
and when you call around, inpatient rehabs, like you said, usually have PM&R doctors, but ask them, have they taken students before, and has that student gone into rehab?
Good question.
Maybe get that contact info and check, because the whole way medicine works is if you go do a rotation with somebody you don't like, you're not going to go into that field, right? And if you do it with somebody you like, you tend to like that field. And so get some background info if possible on the attending. Have you had a student? Yes. When? Oh, last year. Do you have their contact? I just need some guidance. And then talk to them. Hey, is this guy or lady worth rotating with? And if they tell you no, don't waste your time.
That's excellent advice.
And you're going to probably get a lot of no's, right? Sorry, we're not taking any students. You just have to go through the directory, keep calling and emailing and reaching out to someone. Someone will take you.
Yeah.
I have a question that I wanted to ask Sheena, since we probably have a lot of medical students on. For those who are able to do a wave, what's some advice you would give to them on what not to do while you're on a rotation? Because residents typically have a big say on who matches into your program.
Yeah. So, I mean, the big things are obviously showing interest, right? So, you know, you want to be engaged, ask questions, be prepared. You know, say if you know that later in the day, you guys are going to be getting an admission on a patient who has a spinal cord injury, you know, maybe read up a little bit on the Asia exam so that you can participate during the exam. Just be like a normal, nice person, you know.
Yeah. Put your cell phone up.
Yes, I was gonna say, don't be one of those people that is always on your cell phone, because it will come up when it's time to do the ring.
Yeah. And say if there's time, like when you're just sitting around, the residents are doing notes, you know, ask it, hey, can I go hang out at the gym? You know, the therapy gym, you can watch therapies. You won't, you know, you'll learn a lot from the residents, but you'll also learn a lot by just hanging out with the speech therapist or the, you know, PT, OT.
Absolutely.
Yeah.
You know, some of my most sought after students did not have the highest board scores, but their personalities were so engaging. Their work ethic was incredible. And those are the ones, you know, that when I'm talking to various program directors, they're like, wow, this one's amazing.
They have their pick.
Yeah. And I mean, yeah, so be engaging, don't be distracted, read up, work hard. You got to work hard. You can always work harder.
Always. And I think, you know, I think people are always going to run into cranky residents. It's just a matter of time, you know, as a resident, you're trying to be in and out, you want to get stuff done. So it's definitely a balance of trying to help and then not annoying them. But don't let a cranky resident kill it for you. You know, if they are being not so nice, maybe ask to switch rotations, or, you know, just try to be as helpful as possible.
You know, one good advice is Dr. Hamilton at Baylor. She and I talk frequently at Baylor.
She was our program director.
Yeah, at Baylor in Dallas. And one of the things we always talk about is, she's like, can I train them? You know, can I train them? I don't expect them to know everything. That's what they're here for, to be trained. Are they trainable? Do they take criticism? Will they work hard? Will they take direction? Are they humble? You know, if you're trainable and you come across like that, programs will like you, you know.
Mm-hmm. Yeah, absolutely. Do we have any other questions that came up? Let's see. What's up to Dr. Kristen Taylor? We'll have to get you booked on here.
Peds rehab.
Someone said, what other healthcare professionals are part of your care team?
So is this for you all or me or what?
I know. Either any of us can answer. Huh? Yeah, PT, OT, FT. Those are your staples. Usually, like at a pediatric rehab, you're going to have a recreational therapist, neuropsychist. Yep. Huge.
Case manager.
First of all, I always say case managers have the hardest job in a hospital, so be nice to your case manager. And I have another tip about rotating. Be nice to the program coordinator. You guys don't know how much say a program coordinator also has. They're typically the ones trying to get you all your credentialing done. They're going to be the main source of contact for emails.
Yep.
Do not send a nasty gram. Just know that they're getting flooded and they'll get back to you. It's okay to check in, but don't be mean to them.
Yeah. Also, the care team or the physicians you work with a lot in rehab, you know, when you're on the inpatient side, you'll work a lot, obviously, with internal medicine, the various specialties. You'll call consults with nephrology, cardiology, and whatnot. Outpatient-wise, for me, I deal a lot with neurosurgery. I deal a lot with orthopedics. And then we deal with family practice and internal medicine. But family practice, probably more for my referral base, but neurosurgery and orthopedics.
We talk to them all the time.
Quite a bit, yeah.
Mm-hmm. Absolutely.
There's a question here that's getting a lot of likes and hearts. So Justin Owens is asking, are there any landmark trials that everyone going into PM&R should know about?
We need Dr. Lan Lee on here because she is always reading. The flame trial, as Dr. Omar Selod said earlier, it was a pretty big trial. Although I think recently that they may have, right, there was a counter, and that trial is just talking about Prozac helping with with motor recovery and stroke, and can also help with mood. So we typically start patients on a SSRI and they're rehabbing it.
You know, I haven't heard much of students really being required to quote literature, to be honest. You will sit as a student, usually on a journal club. You know, many years ago, I would tell students to just, you know, read about Waddell's signs and back pain, you know, some old articles that are, you know, so many
spasticity, right? Isn't that one?
Yeah, but I'm not sure there's any literature you're expected to be, you know, to quote.
You know what? Do you remember the name of that article that Dr. Porter used to try to make us read about spasticity? Yeah. And he's like, did you read it? And then you like, I tried. He's like, you fell asleep, huh? I was like, yes, but I did open it up, Dr. Porter.
Yeah. I don't know. Like if a medical student starts quoting me articles, I don't know that.
I mean, like,
trying maybe a little bit too hard in the sense that, you know, just,
no basic concepts, no spasticity. Like the modified Ashworth scale, if you can know about the Asia scale, I think know what the coma scale is. That is pretty big for TBI. And then know how to do a basic back exam. Know how to know which nerve roots associated with your reflexes, because you learn that your first year, but you don't, you know, like your neurology, a lot of people don't use it, but we use it every single day. You know your basic shoulder exam, know your basic knee exam. Those things will go a long way.
And really the Asia exam, I can't stress, like, you'll learn your MSK, you know, your dermatomes, your sensory, your all that through the Asia exam. So if you know your Asia exam, you'll know how to grade strength, you know, motor, you know, what's a 3 out of 5, what's a 5 out of 5. So really kind of take a look at that. We posted about the Asia scale on our account. So check out some of the links there.
I totally agree. I think that knowing joint spinal cord injury as a resident has made me a better MSK outpatient physician.
100%.
Sure.
Yep.
Yeah. Oh, and then probably just basic medications, you know how baclofen works. Is that too advanced? I just know I just know it's a treatment.
Yeah.
Baclofen and Botox. I think if you know the mechanism of action for baclofen and Botox going in as a fourth year, that is pretty impressive. However, do not outshine your resident all the time, because there's going to be times as a fourth year resident, medical student, you are on it and you know this stuff. So, like, you know, if they're attending, ask you a question or ask a group of questions, let your resident try to get it. But then you can be like, oh, well, I think it's such and such, or I just read about this, but don't be like super gun ho. And then your resident's going to look at you like, okay.
All right. Should we wrap it up, guys? I think we've got a good 40 minutes, 45 minutes.
Yeah. Awesome. Hey, Omar, thanks so much as always.
All right.
I have one last question. Omar, what are the Cowboys going to go this season?
Super Bowl.
That's right.
Guaranteed. We had a great draft, according to many.
You guys did get a good draft.
Right. We've got A+ on the draft. This is our year. We got a new coach.
You guys don't understand.
Right or die, Cowboys fan.
All season during our office is Comedy Central.
A lot of fun.
One last question, Dr. Selod. We're asking all of our guests this. If you weren't a PM&R physician, what would you do?
Oh my God, I'd be depressed. I really don't know.
I think you would be like a sports broadcaster or something.
Yeah, but I mean, people don't realize that. I mean, I'm actually really shy.
What?
Up. Yeah, I know. It's my high school people, they can attest. I was very shy growing up. My mom's a doctor, my dad's a doctor. I was like, okay, I'll be a doctor. I really don't know what I would do. When I was rotating, I was very unhappy. Like I was like, I can't do this. I can't do this. I can't do this. And once I found PM&R, I was like, great. I'm seeing like somebody says the Cowboys are going to go 8-8. Unbelievable. No,
I think that's reasonable.
Yeah, I have no idea what I would do. It would have to be something sports related, but I don't know. I'd be a mess. That I know.
Awesome. Hey, thanks so much. I will get the pleasure of seeing you tomorrow at work.
All right. Thank you guys.
All right. You guys tune in next week. We'll have Dr. Nicolette Finger. She'll be on talking about, she's amazing. She's going to have a lot of advice for you guys. And then you can also follow us on Instagram at thevirtual.physiatry.mentors. And did I say it right?
You got it.
I will mess it up. I got it this time. Good. And as well as
I know you guys, some people are worried that they can't get on these Facebook lives, while we're doing it. So we know that. So we've been posting them. We will post them on our IGTV. It'll be on our Facebook account as well. And like Nisha said, Hayden's helping us with send it up as a podcast. And we'll have a YouTube channel as well. So we are here for you guys.
Hey, Allison, I saw what you just posted, and that's not right.
All right, guys. Have a good one. I appreciate it. Thank you. Bye-bye.